Thank you everyone for joining us today. Today we're going to be talking about COVID-19 management strategies for providers. A little bit about me. My name is Alyssa Smith-Longee. I will be the presenter for today's session. I am Fort Peck, Sioux, Assiniboine. My family is from northeastern Montana, but I grew up in Washington State, so I'm from the Pacific Northwest. I've been at NCUIH as a program manager for almost 4 years now, working on various projects around infection control, vaccine work, COVID work, and I'm also a registered nurse. I'm a pediatric nurse, and most of my career has been in respiratory, and so that's something that I'm very passionate about. And I will also be joined today by my colleague Liz. She'll be behind the scenes monitoring the chat for any questions or technical difficulties that come along. And then I'll also be mentioning a lot of different links throughout the presentation, so she will share those in the chat for you so you have access. Next slide. Just a quick note that this session is being recorded for quality and improvement and educational purposes. If you can turn your camera on, please feel free to do so. No worries if not. And then mute yourself when you're not speaking. And then I also invite you to introduce yourself in the chat. You can provide your name, organization, any tribal affiliation, or anything else that you'd like to share. Next slide. So as I mentioned, this presentation will focus on COVID-19 strategies. And so there'll be two main parts to it. We'll talk about early diagnosis strategies, and then we'll also talk about treatment and management. And then there will be an opportunity to share resources and then also open the floor if there's any questions, or if anything I say strikes something in you that you want to share, there'll be an opportunity for that. And then for the learning objectives, so today we will focus on increasing provider knowledge of early COVID-19 diagnosis strategies, support COVID-19 management practice among urban AIAN healthcare providers, and share best practices for managing COVID-19 in patients with comorbidities. And a lot of what I'll share today are the current recommendations that are out there, but also a lot of the information comes from UIO healthcare professionals who shared on what they think are strategies when it comes to these different topics. And then it's not on here, but we will ask that at the end of this presentation, you complete a short survey. This really helps us learn and understand how we can improve. And we'll provide a QR code at the end where you can scan and access that survey. And there's also a link in the chat. Next slide. So NCUIH, or the National Council of Urban Indian Health, acknowledges that our national office in DC and nearby activities are situated on the traditional homelands of many Native nations. Some of the communities in the surrounding area include the Piscataway, Pamunkey, Nantego, Mattaponi, Chickahominy, Monacan, and Powhatan peoples. These lands have deep historical, cultural, and spiritual significance to Native peoples. Next slide. So just quickly about NCUIH, the National Council of Urban Indian Health is a national representative advocating for the 41 urban Indian organizations, UIOs, contracting with Indian Health Service under the Indian Healthcare Improvement Act. Next slide. All right, so if you've been following sort of what's been going on around COVID-19, specifically vaccine recommendations, there has been some stuff that's been changing, and so I'll give just a brief update on that. Next slide. So to recall for those who haven't heard about this yet, but on May 27th of this year, Health and Human Services Secretary Robert F. Kennedy Jr. announced that the CDC would no longer recommend the COVID-19 vaccine for healthy children and healthy pregnant women. So in response to that, the CDC did update their recommendations, and they also updated the vaccination schedule. So as of now, the CDC recommends a 2024-2025 COVID-19 vaccine for most adults ages 18 and older, and then parents of children ages 6 months to 17 years should discuss the benefits of the vaccine with a healthcare provider. So it's more focused on that shared decision making. And as this is sort of an evolving thing, it's always good to try and stay up to date. And so Liz will put a couple links in the chat where you can access a link that provides updates on the COVID-19 vaccine recommendations, and also includes that second link with the updated vaccine schedule. Next slide. And so looking at COVID-19 burden, it's been over 5 years now since SARS-CoV-2 entered the US, but it still continues to impact Americans' health. This is preliminary data, so it ranges from October 1st, 2024 through June 7th, 2025. And this data, the CDC estimates that there's been 9.8 to 16.1 million COVID-19 illnesses, 2.4 to 3.8 million COVID-19 outpatient visits, 270,000 to 440,000 COVID-19 hospitalizations. And unfortunately, we're still seeing quite a few deaths around COVID-19 with 32,000 to 51,000. And I think that this is important to remember as COVID-19 has continued to evolve. We do need to keep having these conversations and think about how we can keep addressing this so it's not taking lives of our relatives and people. Next slide. And so for us to better understand, and by us I mean NCUIH, the COVID-19 landscape, specifically around UIOs and what the healthcare professionals are experiencing, we disseminated a survey in March of 2025 that recorded responses from 43 UIO healthcare professionals. In addition to that, in April of 2025, we did a live listening session, which had approximately 150 attendees, where we had live dialogue around these survey results, but also some polling questions. And so, as I mentioned, I'll refer a lot throughout the presentation as reported by UIO healthcare professionals, and that refers to the responses that we saw on the survey and also the conversations and the responses from the polling questions in the listening section. So I just wanted to kind of provide that background so that you all understood where that information was being pulled from. Next slide. So I wanted to share just a few key findings from the survey that kind of set the groundwork as to what we're talking about today. And so a little bit about the survey. It was developed as an online virtual survey. It was disseminated across different modalities, social media, our newsletter. What we really wanted to learn from this was any existing barriers to COVID-19 vaccine confidence, but also educational needs related to COVID-19 management. There were a few different key areas we focused on. So like I said, the vaccine uptake. We talked about early COVID-19 diagnosis and treatment. And then we also asked about different education needs that the respondents felt like they may have had. Next slide. And so 43 folks were eligible and proceeded to complete the survey. There's representation across the different UIO facility types, and then there was also a representation across the different professional roles of those who are responding to the survey. Next slide. So one of the things we looked at was the confidence around managing and treating patients diagnosed with COVID-19. And what this diagram shows is that most of the respondents were very confident or competent, but there are some who still fell in that somewhat confident or not confident bucket, which I think just tells us that there's opportunity where maybe we could support somewhere in helping improve that. Next slide. So looking at some of the challenges with diagnosing and treating, and like I said, these findings really kind of set the groundwork of what we're going to talk about today. But with this tier showing, we asked about challenges in regards to treating, and diagnosing among different populations. So you have the diagnosis in the lighter column, and then that darker red treatment. What we saw from this was that in both treating and diagnosing, the respondents had selected elders as the group that they had more challenges with in completing that. And then another thing that we saw is that if you look, you can see that more respondents were having challenges when it came to treating COVID-19, which I think is something that I'm not too surprised by. I feel like there's a lot more that goes into actually treating once you get the diagnosis. Next slide. And then lastly, what this one here is kind of summarizing is that the greatest challenge that we saw with both treating and diagnosing COVID-19, it was reported that delayed patient presentation to the healthcare facility is what folks were saying. And then some other things were limited access to COVID-19 testing in regards to COVID-19 diagnosis. And then in regards to treating, some challenges were limited awareness of COVID-19 treatment options. And then funding was also identified as a challenge for COVID-19 diagnosis. Next slide. So this next part of the presentation will look at early diagnosis and specific trying to improve delayed patient presentation. As you just heard, that was reported as the greatest challenge for both diagnosing and treating is getting clients to the facility. So we'll talk a little bit about some of the benefits of early diagnosis, and then also share some strategies from the UIO healthcare professionals on how to help address that. Next slide. So just a few of the benefits. It improves prognosis. So benefits of early diagnosis: improves prognosis and reduces severity. This is especially the case for patients who are at risk of developing severe illness. So that would be our elders, folks with comorbidities, those with immunocompromising conditions. It allows timely treatment options. This is a big one. We don't want to delay, especially those who are at risk of developing severe COVID. Treatment should be started within 5 to 7 days of symptom onset. And then it also allows for proactive measures. And by that, I mean, maybe somebody has COVID, and even if they just have a mild case, they can help try and keep away from their family members if they don't want to spread, or wear a mask, stay home. So just having that information can be beneficial in terms of trying to reduce the spread of the virus. Next slide. So with testing recommendation, I don't feel like too much has changed with this as the pandemic has progressed. Currently, viral tests are used as a diagnostic to detect current infection with SARS-CoV-2. So that's the PCR test and the antigen test. A couple points I did want to just highlight around testing that may sometimes be a misconception among community members, but vaccination does not affect the results of someone's SARS-CoV-2 PCR, antigen, or other diagnostic tests. And then the serological test, the one that detects antibodies, and then also CT images alone, they're not recommended in diagnosis of COVID-19. And then in regards to early testing recommendations, the CDC does recommend early testing for all of those who experience COVID-19 symptoms, particularly those at risk for severe illness. And we'll talk a bit about risks kind of throughout the presentation, but age is the strongest risk factor for severe COVID, patients with underlying conditions, and then race and ethnic background. We've seen that there is disparities when it comes to minority groups and COVID-19 outcomes. And then ultimately getting these results, whether negative or positive, will help determine the need for prevention measures and also inform the person's medical care. Next slide. Something that we've seen throughout and we continue to see across different respiratory viruses, but symptoms can be difficult to differentiate from, and they can often overlap with other viral illnesses such as influenza, RSV. And so with that, you may want to consider testing for other illnesses with similar symptoms. For many diseases such as flu, early diagnosis and prompt treatment can also be important in preventing severe illness from progressing. And then just keeping in mind that COVID-19 can also vary from being asymptomatic to critical illness, and these symptoms and severity can change throughout the duration of the illness. So definitely doing close follow-up, especially with those who are. Next slide. All right, so here we're looking at some of the early diagnosis challenges that were shared by the UIO healthcare professionals who participated in the survey or the listening session. And so what we saw was delayed patient presentation to the facility, elders and community members located far from the facility, so transportation barriers, limited access to testing, an overlap between COVID-19 symptoms among patients, mistrust in government and healthcare systems, and then lack of native imagery and resources that community members connect with. Next slide. So we did also ask about not just the challenges, but how can we help, try and address some of these. And so what was shared fell into 3 pretty much like categories or buckets, I would say. And the first one was around accessibility and resources. This came up pretty frequently around access to testing. And so a lot of people were recommending doing at-home testing kits. A couple people actually recommended in those at-home testing kits to include educational materials. I think is a great idea. Maybe you send kits home with folks who aren't necessarily presenting with COVID symptoms, but just so that they have them at home when needed. So including educational materials in there that tell patients or your community members when they should be taking this test, so that they know when it's indicated. And then transportation support. I know that many facilities are already doing this. And then community outreach frequent reminders, patient education on importance of early testing, and then using multiple messaging tools that are culturally responsive and acceptable. I think this is really important, especially as we've heard that treatment needs to start within that 5 to 7 day window of symptom onset, preferably before 5 days. And so I don't know if everybody knows that. Some of our community members may not be aware. And so kind of honing in not to wait until you're at home, feeling really, really crummy and it's too late to start that oral outpatient treatment method. And so that's something that I think could be beneficial. And looking at the multiple messaging tools and reflecting on the challenges people said they have reaching, for example, elders, I think it's good to try and use other ways to reach community members. One is always on, the social media or however they receive their information, but I think that's definitely a good recommendation. And then education and training was another category that we saw emerge. Training not only for our community members, but also for providers on symptoms and treatment options, especially since that changes a lot. It's good to ensure that providers are having access to the up-to-date information. And then utilizing materials and visual resources. So that's fact sheets, one-pagers, brochures, verbal reminders during appointments around COVID-19 symptoms and testing indications. I'm a really big advocate for that, especially like using those appointment times to try and educate patients on anything you think is relevant. I know sometimes people there might be a transportation barrier as to why they're not able to come in as often, or maybe there's some anxiety or that medical mistrust. And so if someone is there with you in that moment, maybe they're there for their annual exam, it's a good opportunity to try and also educate on other things, especially if it's somebody who maybe they've had COVID a few times or they've already had one case that progressed to quite a severe case. Just using that opportunity to also educate. Next slide. And then lastly, there was a few recommendations that kind of fell in this other category, and those included reducing stigma and fear around COVID-19. This was something that I know throughout the pandemic people almost felt shame when they would get positive COVID tests, and so people would be afraid to test. And so ensuring that our patients don't feel that way. And then the pre-appointment screenings for symptoms. This is something I've actually just heard. It came up in the survey, but I've heard a lot just talking with UIOs about maybe someone calls to make an appointment, they're having some type of respiratory symptoms, but you can use that opportunity to also try and see, are they at risk? Should we be getting here as soon as possible? Or here's where you can access a home testing kit. So kind of using that as another step in trying to get them to come to the facility earlier. And then the building rapport and patient-provider trust relationship, which I think is a big strength in UIOs. They serve as a pillar to the community, and they're really a trusted messenger. So I think that's a really good one to have on. Next slide. So to wrap up the early diagnosis strategies, I did want to share a few quotes directly from the respondents. So one of the survey respondents had said, more education of symptoms and letting them know not to wait for treatment, as it may not just be allergies. I feel like I can relate to that one a lot, because a lot of people know it's just allergies. It's just allergies. I think I did that when I first got COVID, but it was just allergies. And tests told me otherwise. And then for this one here, coverage of treatment medication and education material that shows need for early detection. That was a survey respondent. And then normalizing the conversation on getting tested and being proactive about medical care. And that was one of the listening sessions. Next slide. Okay, so I know I've been talking for 20 minutes, so just a quick little brain break. You can go to the next slide, Amy, and I'll just read off a meme. As a nurse, I get a lot of healthcare content across my algorithm, but I thought that this one I related to a lot. But it's me trying to explain the COVID-19 policies that were changed 6 times today to the oncoming shift. And I have definitely felt that, where it feels, luckily it's not as frequent anymore. I feel like it doesn't change quite as often, but there's definitely still changes. As I said, this next part of the presentation will look at COVID-19 management practices, specifically in outpatient settings. Next slide. And so we'll start off just sharing some of the current recommendations that you'll find across the CDC website. And this is a summary of everything. There's definitely a lot more that you can go and read about, but I feel like these are some of the key points that I think are beneficial to share. And so in terms of clinical care for outpatient settings, patients at higher risk for severe COVID-19 might benefit from outpatient treatment. Clinicians should consider COVID-19 treatment in patients with mild or moderate COVID-19 who have one or more risk factors for severe COVID-19 to reduce progression to hospitalization and death. And then I said this a lot, but treatment must be started as soon as possible and within 5 steps of symptom onset. Next slide. So a little bit more in detail about the specific risk factors for illness that may progress to severe requiring hospitalization. As I said, age is the greatest risk factor, but age over 50 years, and then this increases substantially as age increases above 65 years. So we start getting into our elders and our knowledge keepers who we want to protect. And so it's definitely a group of folks that we want to focus on. And then being unvaccinated or not being up to date on recommended COVID-19 vaccinations, specific medical conditions with risk increasing substantially with presence of multiple medical conditions, and then immunocompromising conditions or use of immunosuppressive medications such as chemotherapy. And the CDC, this has been updated as like research has continued to be done, but they have a list of like what falls under the comorbidities or the different medical conditions on we'll share, like I said, so like there's a big resource hub with all the information for COVID that the CDC has, and so you can find that on there as well if you want to read more about the specific medical condition. Next slide. And so there are additional considerations for specific people diagnosed with COVID-19. Pregnant and recently pregnant persons, so at least 6 weeks following the end of pregnancy, are at an increased risk of severe illness from COVID-19. Per the CDC, it is not recommended to withhold COVID-19 treatment from pregnant or lactating women because of theoretical safety concerns. In general, the therapeutic management of pregnant women or persons with COVID-19 is the same as management of those who are not pregnant. I know that this has kind of been a recommendation that's been changing, and so one that I've been trying to follow closely, but this is the current information that I found. And then most children do experience asymptomatic, mild, or moderate COVID-19 illness, but as we know, kids tend to get hit sometimes a little hard with the respiratory illnesses, so some children can experience severe illness. Next slide. And so this here is just a screenshot of some of the outpatient treatment options. There is one that's intravenous, but in terms of clients who may come in or patients that come in to your outpatient setting who may be at risk of developing severe COVID, there is the Paxlovid option, which is an oral route. There's different indications that they include on here that you should be aware of. And then if Paxlovid is not available, there is the Lagreviyo, and from what I've read, the Paxlovid is much more effective. I think the recent numbers was 88% effective in reducing severe COVID. Lagreviyo is not quite as effective, but it's still an option. I know at some points Paxlovid wasn't as available. The one thing to keep in mind with Lagreviyo is that it's not indicated for those who are pregnant, and so that's something to definitely keep with. And there's, I'm not a prescribing provider, so if you are a prescribing provider, you may be more interested in reading about this. This is also available on that COVID-19 site. So looking at symptomatic management, this is just a quick thing, but CDC does recommend all patients with symptomatic COVID should be offered some sort of symptom management with over-the-counter medications to treat things like headache or myalgias or cough if it's indicated. Next slide. And I did want to talk a little bit about COVID-19 plant medicines. I'm not an expert in this or an ethnobotanist, but I wanted to share something I came across from, this is Linda Black Elk. She's a traditional ethnobotanist. And then there's also John, who's an ethnobotanist on COVID-19 plant medicines. And Linda had shared some of the Lakota Dakota plant medicines that she uses for, excuse me, COVID-19 medication. Some of those included a powerful anti-inflammatory species of wormwood, goldenrod, yarrow, gumweed, and stinging needle. And then also she mentions the healing influence that yarrow has as a secondary benefit. And then another thing I saw in there that I thought was beneficial to share was the general antiviral remedy called fire cider, which is a mixture of pungent, hot, spicy ingredients and apple cider vinegar, which can also be taken as a COVID-19 remedy. So this is just like summary, like a brief summary of what is on there, but I definitely recommend you go visit the Native Memory Project. And there's a couple of videos where they share more in detail about this traditional knowledge and something that I thought was really interesting. Next slide. All right, so again, back to our UIO healthcare professionals who shared. This one was looking at COVID-19 management challenges. So the key themes that came from that were delayed diagnosis, delayed patient presentation. I've said it many times. Lack of desire from patients to come get tested. People thinking COVID-19 is over. That was in direct quotes because it was a direct response that we received. Transportation barriers, and then mistrust in government and healthcare system. And so here we have a quote at the bottom from a listening session respondent. With the reduction in symptoms with the reduction in symptoms, the community does not want to test or receive vaccine. And that was a big point of conversation around vaccine burnout, which I know is really, really hard. And you might even experience that among yourself or your colleagues. It was definitely something that we've heard emerge throughout the conversations. Next slide. All right, so some strategies that were shared to try and address some of those barriers included staying up to date on new therapies. That's, like I said, I use the CDC site index to try and get a lot of that information, but that's always something that you want to ensure you're doing as a provider. And then listen, educate, and have empathy. That's also in quotes, as it was a direct response from someone. And I think it encompasses a huge part of our conversations with our community members where, you obviously want to listen, there's opportunity to educate, but also remembering that there is a lot of fatigue with COVID and everyone has a different experience. And so just having that empathy when you're having those conversations. And then social media toolkits, reducing stigma and fear around COVID-19, language-specific information for patients and families, community outreach and frequent reminders, education and focused season education. We are coming quickly. No, we're still in the summer, but around the corner, it is viral season. So having a lot more stuff coming out during that time is definitely beneficial. Access to vaccines. And then this last one came up a lot, but culturally relevant training and materials for both providers and patients. And I will, in a couple minutes here, share some resources, but a lot of the information that we got from the survey and the listening session and conversations inform what the topics were. And like I said, a lot of people wanted to see digital materials as well. And so it's something that we've been trying to work on. All right, so like I said, I'll share some resources with you all. And then, no, we'll go into the resources. Next slide. So we just released a podcast episode that looks at COVID-19 diagnosis and management practices, specifically targeted toward healthcare providers. If you haven't heard me talk enough today, you can hear me talk for a little bit more on this podcast. I was joined by Dr. Kimberly Fowler, who's our Vice President of Technical Assistance and Research Center. And we talk a little bit about kind of what we talked about today, but we also build on some of it and we use some more specific examples. It's a short 20-minute episode, so it's something that you could just kind of put on in the background. It's something that interests you. Next slide. So we also just recently released a pair of graphics that looks at motivational interviewing. And so for those of you who aren't familiar with motivational interviewing, it's a communication technique that can be used by healthcare providers to help patients make positive health behavior changes. This graphic here, it goes into a bit more detail on what motivational interviewing is and some of the strategies. So specifically here, we include the ORS strategies. It has some conversation prompts as well. For example, this one is like, it's great to see you again, or how's your day going? So this one can be used if you want a little bit more of a detailed sort of an educational tool. And then next slide. And the partner graphic here, we're using more of just a visual quick reference one. And this one covers the ORS skills. So the ORS is open-ended questions, affirmations, reflective listening, and summaries. And if you aren't familiar with ORS, this is a core communication skill that's frequently utilized in motivational interviewing, and it can help facilitate positive interactions. If this is of interest to you, the motivational interviewing topic, we will be having a webinar next month that will specifically focus on motivational interviewing and using that to help build vaccine confidence. And you can download both of these graphics from our website. I know Liz has put a lot of links in the chat, but I want to make sure that you all have it, because I know sometimes we say we'll go look at the slides later and then we don't. So they're all there for you. Next slide. All right, so I think I referenced, yes, this is when I referenced that site index hub a lot, but as we kind of talked about, it's really important to stay up to date, and there's so much information being shared everywhere. So this first link is an information hub, and this is where I pull a lot of my information from. You actually have a section on there, one that's targeted toward the general population or the community, but you do have a section that's specific to healthcare providers. And within that, you have one specific to outpatient settings, which I think is great, because sometimes we don't always find that support, and it's often focused in more acute care. And then again, just the vaccine recommendations, the vaccine schedule. And then you can actually reach out to the CDC if you do have direct COVID-19 questions. It's that last link there, and your question will get routed to the correct group that can help respond to your question. Slide. Oh, sorry, here we go. So like I said, we will be having a webinar next month around specifically the motivational interviewing, and I'll also share a little bit more. This survey also included a bit about vaccine hesitancy, and so I will share a bit about that as well, and kind of what folks had said they feel like could help address that, and then a big part of the motivational interview. All right. I think we have talked for about 35 minutes. If you have any questions, feel free to put them in the chat. You can come off mute. If there's anything that I shared that you relate to, or you have some strategies that you wanted to share with everyone, feel free to do so. And no worries if not. You can always reach out later if something comes up. But I'll just give it a moment here, see if anybody had any. No worries. If you put something in the chat, I'll kind of keep my eye out, but we can go ahead and go to the next slide. So I wanted to finish the main part of this presentation with one more quote from a listening session respondent. And so they had said, "The effect of COVID is still being felt today. We're still feeling the aftershock." And I think that resonates a lot with even myself, because it is still here. I see it in my practice today. I got to work specifically with kids, but it does still have an impact, and it's not something that just kind of thrown in the back burner. So I really resonated. Next slide. So we do offer one-on-one technical assistance for member UIOs. If you have more questions specifically related to what I shared today or related to COVID-19 vaccines, you can submit the TA request that Liz put in the chat, or you can also just reach out to me directly, and then we can try and help support you. If it's something like looking at your policies, or maybe you want to get connected to another facility to try and talk about something, that's something that we can try and help support. And so please definitely reach out if there's anywhere that you feel like we could help support you. Next slide. And staying up to date has been kind of a recurring theme in this presentation, but we definitely recommend you sign up for our newsletter. We share not just about this, but a lot of other important information around policy. We share events, and so it's trying to stay up to date with us. And I would say our newsletter is great, so definitely recommend. Next slide. Just a few upcoming events. I already mentioned the one around motivational interviewing. We also have an in-person event, which I think must be in DC. And then our annual conference, we already have the dates set, and there's some information already going around. So plan ahead, book your calendars for the conference. It will be in Washington, D.C. Next slide. All right. Well, we finished early, which I don't think is a bad thing. I think it's a lot of information to process. So if you could please do the survey, like I said, there's the link if you do it in the chat, or you can just scan the QR code and do it on your phone. It's short and it really helps us learn from you all and how we can improve.